Yeah, because people have to choose under live transcript, they have to choose view or show subtitles in
Okay,
order to
yeah.
see what Abby is typing.
And I am seeing a green
Alrighty.
check mark that says captioning is enabled.
Okay, have a good meeting, Mike. Everybody, Merry Christmas. And
Thanks
have
so
a good
much. And you
meeting.
as well, Joyce.
Thank you. Bye-bye now.
Okay, everybody, thank you for your patience while we work out a couple logistics issues. And we're going to go ahead and get started. And today we have with us Susan Martin, the Senior Policy Analyst, or one of them from the Department of Medical Assistance Services. And we're going to go through an overview with you of Virginia's Medicaid Works program, which is Virginia's version of the Medicaid buy-in for working people with disabilities. And before we get started, I just have a couple of my standard announcements. One is that you are all in listen-only mode, just to cut down on some of the background noise and minimize the distractions for the interpreters. If you have a question, we're going to leave about 20 minutes at the end for questions. And we ask you to put those questions into the chat box. And I'll read them aloud as we go along. We have a mixture of VR staff and WISs on the line. If you are a VR counselor, CRCs are available for your participation today. If that's something that you need, you can shoot me an email after the training and I will make sure I get those logged in for you. I'll put my email address in the chat box. If you are a WISA who has been certified as a work incentives practitioner through Cornell, continuing education credits are available for your participation today as well. This training is going to be recorded and archived for the benefit of those who are not able to join us today. It will go up on the DARS YouTube channel, and I will send that link out to everybody as soon as I have it. All right. And there are a couple people in the waiting room. Let me just admit them, and we'll go ahead and get started. And I lost the captioners or the interpreters. Okay, so you guys are back. I just want to make sure that you can spotlight in and out as we go through the PowerPoint, just to make sure this is accessible for everyone. Let me try to share my screen again. Yeah, for some reason that's just not working. Probably gonna have to just do it like this so that the interpreters can spotlight in and out. But just to give you a little bit of a background of what we're going to cover today, I'm going to talk about some of the eligibility criteria for Medicaid Works, both at the initial eligibility determination stage and once clients are enrolled in Medicaid Works, so the eligibility criteria for initial and ongoing eligibility. And then I'll turn it over to Susan, and she's going to talk about the differences between some of the services that are available under the Medicaid Works program and Medicaid Waiver, as well as some of the policies for DSS eligibility workers once a client enrolls in the program. And she'll talk a little bit about the enrollment procedures and how that works. And then, as I said, we will have time for questions at the end. So when we're talking about initial eligibility for Medicaid Works, just like any other Medicaid program, there's non-financial criteria and financial criteria. And so I'm going to go through the non-financial eligibility criteria first. So the name of the program is Medicaid buy-in for working people with disabilities. So the first criteria is in the name. Obviously, the person has to have been determined to have a disability. And that disability determination can come in one of two ways. One is if they are currently enrolled in SSI or SSDI, and they have a disability determination already made by the Social Security Administration, that is suitable for the purposes of Medicaid Works. All right, so that has to be a current determination. So it can't be a situation where a client has gone through a continuing disability review and found no longer disabled. They have to currently be eligible for benefits. All right. If they are not on SSI or SSDI, then a disability determination can be made at the time the client requests enrollment in Medicaid Works through the Disability Determination Services Unit, or DDS. And that is actually a part of DARS. All right, so disability determination one of two ways. If they're on SSI, SSDI, they're automatically qualified as disabled for Medicaid Works. If not, then a separate determination can be made by DDS. All right. There's also an age criteria. So the client has to be at least age 16, but not older than 64 years of age in order to participate in Medicaid Works. They have to also be employed at the time that they request enrollment in Medicaid Works, or at least have a letter of employment stating when their job is going to start. All right, so there's a couple conditions when DMS and social services look at what constitutes employment. Number one, the person has to be competitively employed in an integrated setting, which means that they have to be working within the community with colleagues without disabilities. All right. So it can't be something like a shelter workshop. That would not be considered competitive employment. I know a lot of those have gone away, but that would be an example of something that wouldn't qualify as competitive employment. It has to be in an integrated setting, working with people without disabilities. All right. And people are saying that they cannot see the PowerPoint. I am sharing the screen. I'm seeing a couple folks saying in the chat box that they can't see the PowerPoint. Let me see if I can share it again. All right, sorry about that, everyone. It looks like the screen share went off.
Got it.
But you can see it now?
Yes.
All right, so I did send this out to everyone before the training, so you will have the slides. I'm just going to pick up where we left off. So we went through some of the non-financial eligibility criteria, the disability criteria, the age criteria. Now we're talking about Medicaid Works non-financial criteria in terms of employment. So again, competitive employment in an integrated setting. That means working in the community with people without disabilities. Compensation has to be at it or at least above a minimum wage. All right, so they have to be working at least minimum wage for the community that they live in. And they have to be paying payroll taxes. And it says here documentation is required. So that could be something as simple as when a client requests enrollment in Medicaid Works, as proof of employment, they can submit their pay stub to show their tax withholding on there. That's a suitable criteria for proof of taxes being paid. Medicaid Works is also available to folks who are self-employed. So if a client works for themselves, some documentation they can show to show earnings is proof of earnings through the IRS filings, business record, or business plan. All right, that's considered suitable proof of employment for folks who are self-employed. All right, just to talk a little bit now about the initial eligibility in terms of income. So the income limit is now 138% of the federal poverty level, and that's countable income. And I'll talk a little bit about how DMAS is going to look at countable income in just a minute. But 138% of the federal poverty level is $1,482 a month for an individual. All right. And that's a big change as of July 1st, because as you may have known, that prior to July 1st, and folks are entering the waiting room, I'm just going to go ahead and admit them. Prior to July 1st, since the implementation of the Medicaid Works program about 15 years ago, that initial income eligibility limit was capped at about 80% of the federal poverty level, which is only about $850 a month this year. So that really precluded a lot of folks who were otherwise eligible for Medicaid Works from participating in it because they had a higher income. So particularly folks that had a disability and had a higher SSDI check could not participate in the Medicaid Works program because their SSDI checks were higher than that limit. However, because of this income limit change, with the income going up to 138% of the poverty level, $1,482 a month, that is going to open up the program to more working people with disabilities who may have otherwise not been able to participate in the program previously. All right, so if you are a counselor and you had folks who may have tried for Medicaid Works before the income limit changed on July 1st, but they were denied because of their income, it might be worth having them go ahead and apply again because of that income change. All right, so it's $1,482 per month for an individual, or $2,004 if the applicant has a spouse who is also disabled, 65 or over, and is also applying for or receiving Medicaid. If folks are on SSI or 1619B at the time that they request an enrollment in Medicaid Works, they're automatically deemed eligible for Medicaid Works from an income perspective. So I always tell folks that if they're on SSI and they want to apply for Medicaid Works, the best time to do that would be as soon as they start working or as soon as they have that job offer in hand that they can show their eligibility worker and request Medicaid Works enrollment at that time before the SSI stops, because it's going to be a lot easier for them to be deemed financially eligible if they apply when they're still on SSI. I'm just admitting a few more folks. One moment. Okay, so a minute ago, I talked about how DMAS and social services is going to look at income from a countable income perspective. All right, and the way that they count income for the purposes of Medicaid Works is going to be in the same way that Social Security would count income for an SSI recipient. So this formula is going to look very familiar to a lot of you because it's the same exact process. So when they're looking at whether or not a client has income below that 138% of the federal poverty level, they look at a couple things. Number one, they're going to look at all unearned income. The most common example of that would be like Social Security disability. And from that, they don't count the first $20 of any unearned income. And then they're going to look at earnings or wages. So they don't count the first 65 of the wages, and then 1/2 of that remainder is also disregarded. All right, so again, same process as Social Security would count an SSI recipient's income is the same way that DMAS does for the purposes of Medicaid Works. So just a quick example. Say somebody's going to work, their gross earnings are $565. DMAS is not going to look at the first $65 of those earnings. That brings countable income down to $500. And then from that, they're going to divide the remainder by half. So countable earnings are $250. So out of the $565 that the client makes, only $250 is going to count towards that income limit when determining whether or not their income is below that 138% of the federal poverty level. And again, if a client is on SSI or 1619B at the time that they apply, they're automatically going to be found income eligible. All right. Also, from that, they're going to look at the value of any work incentives that the client may be using. So, for example, if they have something like an impairment-related work expense, an IRWE, a blind work expense, a BWE, or something like the student earned income exclusion. Hold on. Folks are still coming into the waiting room. I'm just going to pause and admit them. The value of any work incentives are also going to be disregarded from that income calculation when social services determines whether or not the client meets that income criteria. So again, $20 from under an income doesn't count. The first $65 of wages does not count, plus half of the remainder, and the value of any work incentives are all disregarded when looking at whether or not a client is financially eligible. Okay, in terms of resources, the standard resource limit, and keep in mind that this is before the enrollment is approved. Income and resources are going to look a lot different once the enrollment is processed. But in terms of initial eligibility, the countable resource limit is $2,000 for an individual or $3,000 for a couple. And that's the standard income limit for each Medicaid group. All right. But the difference is for something like Medicaid Works, if a client has something like a trust, or if they have an Achieving a Better Life Experience or ABLE account at the time that they apply for Medicaid Works, any resources that are put in either an ABLE account or in trust are not going to count towards that countable resource limit. All right. So social services is only going to be concerned with how much money the client has on hand in maybe a checking or savings account that's not already excluded under something like an ABLE account or trust. All right. And so similar to income, if folks are on SSI or 1619B at the time they request enrollment in Medicaid Works, they're going to be found eligible from a resource perspective too. The only time that social services is going to look at resources for an SSI recipient or somebody that's on 1619B is if they have countable real property. So in other words, do they have property that they're not living in or living on or using for a business? And, does that property have a value? All right, but if there's no real property, they're going to be found eligible from a resource perspective automatically just by way of SSI or 1619B. All right, and just give me 1 second. I just have to get a drink of water. Couple additional criteria for Medicaid Works is that folks who want to enroll have to sign the Medicaid Works agreement. I'm not going to take the time to go there and go through it because I did send that along with the materials. I'll let you go through that on your own time. But basically, what the Medicaid Works agreement says is that the client understands the eligibility criteria for Medicaid Works in terms of income and employment status and resources and so forth, and that they will report any changes to their social services worker that could impact their eligibility for Medicaid Works. All right, so that's basically what the Medicaid Works agreement says. All right, so just to be clear, if you have a client who's already on Medicaid prior to enrolling in Medicaid Works, they're not going to have to reapply for Medicaid in order to access Medicaid Works. All they're going to have to do is submit a copy of the Medicaid Works agreement to their social services worker, along with a copy of proof of employment. So either a pay stub or a job offer letter if they're not working yet. They don't have to go through the whole Medicaid application process. The only time an application for Medicaid is required to enroll in Medicaid Works is if they're not already in one of the Medicaid covered groups already. All right. So in addition to the Medicaid Works agreement, they also have to establish a work incentive or WIN account that they would use to deposit all their earned income into from work. All right. So there's a lot of confusion in terms of what WIN accounts are. I get a lot of questions about this all the time. I tell people when they go into the bank or credit union to tell the representatives that they want to submit or open a WIN account, and they're confused. They don't know what it is. So just to be clear, a work incentive account is a regular checking or savings account established at any bank or credit union. The only difference is that the reason why it's called a work incentives account is because social services is going to require an individual to deposit any income that they earn from work into that account. And they don't not want folks like mingling money. So if somebody's on, let's say, SSDI and they're working, they can't keep the money from their SSDI check and the money that they earn from work in the same account. That has to be separate. So that's the purpose of the WIN account. All right. And also, they have to submit a premium to participate in Medicaid Works as required. Right now, there is no premium for Medicaid Works. There has not been one implemented since the program started. But in the future, if one is ever required, it's going to be implemented on a sliding scale based on the client's income. But right now, there's no premium. Okay, this next one is kind of a note for the VR counselors on the line. If you have a client who is interested in enrolling in Medicaid Works, maybe wants more information on how to access it, needs help submitting the Medicaid Works agreement, proof of employment, and so forth, keep in mind that helping a client access Medicaid Works is a billable WISA service. That procedure code is A3012 under the Work Incentives Budget and Aware. So if you do have a client who wants to apply for Medicaid Works, that service is available to help the WISA can help the client walk through that application process. All right. If a client is not receiving services from VR, they can also go through the Work Incentives Planning Assistance Project. Or if they are on a certain type of waiver, the Home and Community-Based Service Waiver also provides certain WISA services, of which Medicaid Works is one. But if they're working with you guys, if they have an active case with DARS and they're in service or employed status, and you want them to receive the help enrolling in Medicaid Works, accessing it through the Work Incentives Budget and Aware would be the way to go. All right. So now let's talk a little bit about how things look once a person is enrolled in Medicaid Works and what the eligibility criteria is to remain in it once they're approved. So the earned income limit jumps up to $75,000 per year. And again, that's earned income limit is just earnings. So they're allowed to make up to $75,000 per year, which is broken down to $6,250 a month. All right. So obviously, that's substantially higher than any of the other Medicaid covered groups. Once the client is enrolled, they're treated as a household of one. So only their income and resources is going to be looked at going forward. And all the earned income exclusions that we talked about previously, the minus $65 divided by 2 minus any work incentives, that all applies to earned income once a client is enrolled in Medicaid Works too. So when DMS is looking at whether or not their earnings are more than that $75,000 in a year, all those earned income exclusions are going to apply as well. If a client is still receiving any unearned income once they're already enrolled in Medicaid Works, such as SSDI, that unearned income limit has to remain under 138% of the federal poverty level at all times, even after enrollment, for the client to continue to be eligible under the Medicaid Works covered group. All right. So for earnings that are deposited into a work incentives account, the resource limit jumps up from $2,000 in resources at the time a client applies to, this says $41,399. The 1619B income limit was just published yesterday. It just came out and I didn't have a chance to change it on the slide. But for 2022, that 1619B income limit is just over $46,000. And keep in mind that the 1619B income limit and the Medicaid Works resource limit once a client is enrolled in Medicaid Works is the same. All right, so for 2022, the resources accumulated into a work incentives account is going to be roughly a $46,000 limit. And keep in mind that only resources that are retained in a work incentives account are going to count towards that $46,000 limit. Any money that is put into a separate account or left in a separate account apart from the work incentives account is still going to count as resources. And that resource limit again is $2,000. So if you have a client who wants to save resources up to that $46,000 limit, they have to make sure that it's placed in the work incentives account. All right. So other things that they're going to exclude when looking at ongoing eligibility for resources are things like if a client has a cost of living increase in Social Security benefits, like is coming in 2022, that is not going to count if the increases are put into a WIN account. So cost of living adjustments and COLAs, or if a client has lost their job through no fault of their own, and they're on something like unemployment compensation. We saw that a lot in the last 2 years with COVID. Those unemployment benefits are also not going to count if they are put into a work incentives account. And again, they have to be put into that account specifically in order for them not to be counted. All right. So resources accumulated while in Medicaid Works that are in another account, like an IRS approved retirement account or a medical savings account or ABLE accounts that we talked about, are excluded. So social services is not concerned with resources that are put into like an ABLE account or other exempt account. They're only going to be looking at what is in a work incentives account once a client is enrolled in Medicaid Works. All right. If there are resources that are separate, like in a checking or savings account that are not exempt under the law, then social services is going to evaluate them with the regular ABD rules, so age, blind, and disabled Medicaid rules. They're going to be looking at resources under $2,000 for an individual or couple for resources that are not in an approved account. And again, resources, they're going to be looking at a household unit of 1. All right. So this next slide is talks about the safety net for people who lose jobs through no fault of their own. And I'm going to cover it just because it's in there, but I want to preference this slide by saying that this guidance explains how the policy usually works when somebody loses their job. Right now, because of COVID, we are in a pandemic emergency period, which means that clients are not having their Medicaid changed or terminated for any reason while we're in that special emergency period, unless they request termination or they die. All right, so as I'm going through the slide, just keep in mind that this is normally how it works. Right now, we don't know exactly when that emergency period is going to expire. But once that period does expire, this is the way that it normally works if somebody loses a job. So if somebody loses a job through no fault of their own, meaning like let's say that they were laid off, they are allowed to keep their Medicaid coverage for up to 6 months while they're looking for another job. All right, so they have 6 months from the time that they lose their job to find another one in order to maintain their enrollment in the Medicaid Works program. If they have resources during that period that they put into a WIN account, so a work incentives account, those resources are going to be disregarded when social services looks at whether or not a client is going to be eligible for Medicaid in another category. So another category could mean Medicaid expansion, for example, or waiver. All right, so they're going to disregard any resources that are in a WIN account up to 12 months. All right. And Susan, is that correct? Just correct me if I'm wrong. So anyway, so any other resources that a client may have, and like an IRA account, are also disregarded for future Medicaid determinations when looking at whether or not a client is eligible for Medicaid under another Medicaid covered group. So normally how it works is that as long as a client has lost the job through no fault of their own and they find another one within 6 months before that safety net expires, their eligibility for Medicaid Works can continue. And if not, if for some reason they can't find another job, they can be evaluated for Medicaid coverage under a different Medicaid covered group. But then again, keep in mind that also we are in that pandemic emergency period where coverage is not being changed or canceled. All right, and with that, I'm going to turn it over to Susan to talk about personal assistance services.
Okay, sorry, I was trying to answer you before and I couldn't unmute fast enough. But no, you, as always, covered the eligibility process really well. And I don't think I could add to it really. So we come to the part of this presentation that I've learned from experience over the past few years, there's a lot of confusion about. We frequently have somebody who's already enrolled in one of the Medicaid waivers. It's usually one of the developmental disabilities waivers, and who wants to try Medicaid Works. The thing is that Medicaid Works is not a waiver, and a person can't be enrolled in one of the waivers and in Medicaid Works at the same time under normal circumstances. I'll say that because Michael talked about the public health emergency. And so what we do know right now is that we do have some people who sometimes since early 2020, they have asked to or expressed interest in Medicaid Works, and they're eligible for Medicaid Works, but they aren't being taken out of the enrollment in the waiver right now because technically that's a higher level of coverage. And because it has a higher income limit and some other things as far as the entry level of it. So what we're doing is just keeping the person enrolled where they have been, as long as it's a full coverage group. And then at whatever point that we do unwind from this public health emergency, everybody's coverage is going to be reviewed, and we may have people who are no longer eligible, who have stopped working and gotten better jobs than they had before. Not necessarily Medicaid Works, but I mean, just in general, we're probably going to find we have people that aren't still eligible. But before we can do anything with their coverage, we'll evaluate, meaning local Department of Social Services will evaluate a person's eligibility before they're going to do anything. So at that point, we would be honoring the request for Medicaid Works and going back to whatever month they started working as far as disregarding resources that they've put in a WIN account. So we're just in a very weird time right now. And so we are going to have to, do some, I guess, backwards looking at whatever point we are out of the public health emergency. So one of the differences between Medicaid Works and the waivers is that under Medicaid Works, the full array of services that a person would get in a waiver aren't covered. So things like respite, environmental modifications, assistive technology are not covered under Medicaid Works. Personal assistance services are covered under Medicaid Works, but they're done a little bit differently than in the DD waiver. They follow the same criteria as the CCC plus waiver, which is, I guess, kind of referred to sometimes as the personal assistance waiver. So that does not have the same services either as the DD waivers do. And they're paid a little bit, through a different payer source and some other differences like that. But a person who needs personal assistance services can receive them and be in Medicaid Works. And that is at home and in the workplace. They can get services at either and or both locations. Personal assistance services won't be covered under Medicaid if they're already being provided by another source, another payer source. Okay. Can you change slides?
I'm trying. It froze up on me for a minute there.
It's been so long, I really don't remember what the next one was.
Yeah, sometimes it works and sometimes it doesn't. Okay, there we go.
Again, this is a little bit repetitive. I often talk ahead of myself on slides. The income limit's also different. So sometimes we'll have somebody who's in one of the DD waivers generally, who already has income that's too high to go into Medicaid Works, because the income limit is for waiver services right now is as high as $2,382, and it will be going up probably around the end of January, which is usually when the federal poverty level changes. And as Mike pointed out, the income limit for entry to Medicaid Works is 143% of the federal poverty level. I'm sorry, that will, which is substantially lower. And I just want to backtrack. The 300% of the SSI amount actually changes January 1st. It's based on the SSI amount, which changes on January 1st. So a lot of things, a lot of moving targets to keep track of here. So that one is going to increase, but it's going to be January 1st, not later than that. We count gross income for the eligibility in the 300% of SSI covered group, which means if a person already has some kind of income, like Social Security benefits, then that's going to be kind of offset the amount that they can earn and still be within that income limit of right now $2,382. The resource limit is also a very hard resource limit of $2,000 in countable resources, unlike with Medicaid Works, where the person can earn, up to almost, what was it, Mike? Over $40,000 it will be, can retain that.
Yeah, it's just over 46. That's
46.
going up as of January 1st.
So, I think we can probably go on to this next slide, because I think it's what I want to cover next. So I guess a person who wants to do both has got to make a choice, and sometimes it might be a difficult choice. Sometimes the choice is sort of made for them because they have a particular need, a health need, or their income limit is already too high for them to be eligible in Medicaid Works. But somebody that needs all of the waiver services that they can get under the DD waiver, of course, has got to think about giving those services up if they want to go into Medicaid Works. And all of this it is, of course, the current time, what the policies are right now, because they have changed in the past and they could change. I think there's a growing recognition of the need for people to have assistance in the areas that they need it in and still be able to work. So, if I had a crystal ball, it would be great, but I do feel like some of this may change in the future. And I really think it should. But right now, the person may, if they want to go into Medicaid Works, they may have to think about, what it would mean for them to give up some of these other services. I talk to people fairly often who have been in the DD waiver for a while, and they've already, let's say, gotten some of their assistive technology and their environmental modifications, and they're not using respite services really that much. And they've gotten a great job offer. They often choose to go into Medicaid Works, and they feel like with the money that they're earning, they could probably pay for some services on their own or some equipment on their own, or perhaps find some other avenue to get them through a grant program or something like that. So we do have people that do go from one to the other. And there is a window that a person can come out of a DD waiver and try Medicaid Works, and then go back if it's not for them, if that program just working maybe is not for them right now, they can get back in the DD waiver. The slot will be held open, and I think it's a 6-month period. I don't work with that waiver, so I'm not as knowledgeable about how that works, but it's a policy that changed about 1.5 years ago. So that's kind of an additional safety net to the safety nets that Michael talked about a little while ago. So, and I know I saw a question flash up about the whole thing about, my client requested Medicaid Works and nobody changed his enrollment. And I think that goes back to the fact that we're in this public health emergency right now. But under regular times, what we tell the eligibility workers is if there's somebody who has SSI or 1619B, and they want to be in Medicaid Works, that they should be in, go ahead and enroll them in Medicaid Works before they lose their SSI or their 1619B. Once the person starts working and earning enough income, they'll lose their SSI and then even could eventually lose their 1619B status. But the Medicaid Works safeguards are, actually more robust, and they'll stay in place. Because right now, Medicaid eligibility for SSI and 1619B are considered a higher, not really a higher level of coverage, but they have fewer eligibility requirements, which makes it a higher level of coverage in the way that we evaluate for it. If anybody was at the presentation that I did last week, that will make sense. So we always evaluate somebody in a covered group, if they fit and meet a covered group that doesn't have a resource test or doesn't have an income test first. And so that is why I think eligibility staff has been leaving people enrolled as 1619B or SSI enrollees. But again, there will be a mechanism in place to go back and adjust for Medicaid Works, to the point where they actually made the request and they were eligible. So that, we're not going to say, well, you're working now and your income is too high. As long as when you submitted that request, you would have been eligible and met the income requirement, then we can go backwards. I will make sure that if you do have a client who this happens to, and you have difficulty with communicating that to the local Department of Social Services, to the eligibility worker, just let Michael or me know, or both of us, and we will, make sure that we correct that situation. So, how do normal under regular times, how does somebody get into Medicaid Works? They would submit that Medicaid Works agreement, and Michael talked about, and then their Medicaid Works would always begins the month following when person submits a signed agreement. This means that the person has to really time this before they start working and earning over 138% of the federal poverty level, or their total income, countable income is over that. So it needs to be done for most people pretty early in the working process. Now, because the income limit did go up, we do have more people that are working only a few hours a month right now, and that might give them a little bit more of a window to request Medicaid Works. But try to get your clients to do it as soon as possible when they know that they're going to be working. I think I saw one of the questions was about how do you show your income if you haven't started. I may have to yell at my cat he's trying to literally climbing the wall right now. How do you provide proof of income if you haven't started working? You don't. What the person has to do is provide the offer of employment letter, and if they don't receive one, they just would need to ask for some kind of verification that they've been offered the job and what it will pay. And that's what they submit, because a lot of times people do actually apply and get into Medicaid Works before they're working at all. Okay. We tell the eligibility staff to, they are the ones that enroll the person and approve it. They send DMAS, just a copy of the materials, the signed agreement, and the verification of the WIN account and the person's income, and we just keep them for tracking purposes. Still, after all these years, I do still run into some eligibility workers who think that we need to approve it. There are 120 different departments of social services, And some have a lot of Medicaid Works members, and some have none. And some, may get one just once in a blue moon, and the worker may be relatively new and have never had that person request Medicaid Works before. So, we kind of see a lot of everything because of all of those situations. But just so that you know, DMAS does not have to approve it. The eligibility worker does. Okay.
Sorry, it's frozen again. Technology is wonderful as long as it works, and when it doesn't, it's a pain.
I think that's probably most of the formal presentation, actually. So we're probably getting into the time where we can answer questions.
Yeah, and I'll go ahead and pull up the chat box and we'll go through. We have about, looking at the time, about 40 minutes. So I'll go back up to the top and then we can start reading the questions off. And I apologize, my screen is frozen. It's very slow. So just bear with me for one moment.
I wonder, I think things have been slower too. And I wonder if, this is because perhaps they're doing some, mitigation of some of the things that you all might have read about in the news, with some data things happening. And they may be, have shut down some bandwidth. They may be doing some, behind the scenes things that are slowing connections down. I don't know.
Yeah, it could be.
Michael, can you see the chat now, Michael?
Yes.
Perfect.
Yep. So let's just start going through some of the questions. And so somebody asked, what is the turnaround time for someone in 1619B to get approved? I assume you mean approved for Medicaid work. I have a client who submitted his application on 8/18, and there has been no determination made, and he's still in 1619B.
That's what I was just talking about earlier. Because they've been enrolled as 1619B, which does not have a separate income evaluation, and from a lot of people does not even really have a separate resource evaluation if they don't have any kind of countable real property. That's considered a more robust covered group, and that's where the eligibility staff is going to lead them because of this public health emergency that we're under. So just, make sure that the person saves, or if you're, assisting them, save copies of when you submitted the Medicaid Works request and what their income was the month that you submitted it, or they submitted it.
Okay, and then somebody asked to clarify, we advise the client to open a separate or normal checking or savings account that they will then personally designate as the WIN account. They don't need to tell the banker they want to open a WIN account, right? What I did is I developed a letter, just a form letter that a client can take to the bank or credit union that says that a work incentives account is the same as a regular checking account, and that the bank or credit union will certify that the client still has control over the money and all the funds in it. And they are just labeling as a work incentives account at the time that it gets set up. Susan, does it have to be labeled as a work incentives account at the time it's open?
Yes, it needs to be, well, it kind of depends. What usually happens is that the person already has an account that their benefits are going into, a checking or a savings account. And so they would need to open a second account, designate that as the WIN account, and tell the eligibility worker that's the WIN account. And then all of their earnings has to be deposited into that. And also they can take their COLA increases out of their checking account that their Social Security is deposited in, and put it in the WIN account if they need to. Most people don't need to, but it's just a way for us to make sure that nobody goes over the income limit because of a COLA. So most people don't need to do it, but we do run into occasionally some people that would actually go over 138% of the federal poverty level if we had to count their COLA. And so that COLA has to be put in the WIN account every month. It's kind of a pain, but it has to be done every month so that the eligibility worker can track it. If you get a situation like that, you can always, reach out to me and I'll help you kind of walk through that. I have helped eligibility workers walk through it. So the couple of times that we've had. And I just wanted to respond to, I just saw a chat that said somebody's about to go over resources for, I don't know if they mean Medicaid Works or 1619B, because we're not canceling anyone's coverage right now, regardless of what their resource amount is. If they lose their 1619B status with the Social Security Administration, we're not going to cancel their Medicaid either. So as long as we are still in this public health emergency, which right now runs at least through nearly the end of January and probably will be extended. At some point it's going to end, but they have been extending it now for a really long time. So we just don't know, unfortunately. So
Another question from Heather asks, how do you determine IRBs when an individual is trying to qualify for Medicaid Works and they're currently covered by 1619B? Well, Heather, the criteria for IRBs is going to be the same regardless of whether you're looking at eligibility for SSI or for a program like Medicaid Works. The rules are going to apply the same. So what DMAS is going to look at when they're looking at determining countable income is whether the client has expenses that are related to their disability, their work that they pay for out of pocket and that are not reimbursed. All right, so there's no difference really between the criteria for DMAS or for SSA in terms of how they look at IRBs. As long as a client who has an expense that fits into those categories, more than likely it would be counted as an IRB for the purposes of a Medicaid Works determination. Let me go down to the next question. Oh, somebody's just asking for a copy of the PowerPoint. I will get that to you, or better yet, if there's anybody who still needs a copy of the PowerPoint, just shoot me an email and I'll make sure I'll get you a copy of the PowerPoint and the Medicaid Works agreement as well. Somebody asks, how many WIN accounts can a beneficiary create or have? Answer to that is one. You can only have one work incentives account at a time.
Well, can I answer that a little bit? There's only one WIN account that your earnings or the person's earnings would be deposited into, but they can designate other accounts as WIN accounts. It's actually in one of these slides where they could have an IRA or some other type of IRS type approved account, which we actually mention in detail in the Medicaid policy, the types of accounts. And so those would also be, or could be like a secondary WIN account that will remain excluded actually, even if the person comes out of Medicaid Works indefinitely, whereas the WIN account where their earnings are to be deposited, which is excluded for a year if they come out of Medicaid Works. But the important thing to know is, and that for most people, they just are going to have the WIN account at least for for a while. And that's where all of their earnings needs to be deposited. The person can take the money out of the WIN account. They can take it out and spend it. They can use it. They can put it in an ABLE account. They can even put it in another account. But if they do it, it loses the special protection that it gets in the WIN account. And we actually had a situation where the member was taking money out of her WIN account, putting it back in the same account where her Social Security benefits were housed. And I'm sure it was probably just more convenient for her, to pull her money back and then write checks from it. But unfortunately, that was causing us to have to count it. So we knew that she just didn't understand, the policy, and tried to not penalize her for it as long as she, stopped doing it basically. So, but, a person can move it around. They just have to understand that it's going to then be subject to if it's put back in a regular checking account or commingled with their benefits, it's going to be then subject to the same counting rules. If they put it in an IRA, it won't be, it'll be excluded, which is probably the better thing to do with it anyway. So hope
Sure.
that's helpful.
Okay, so Beth asked, are clients able to get more personal assistance hours than they are usually allowed under the CCC plus waiver if needed?
Again, that is not my area, but I know that if a person thinks they need more, feels like they need more hours, they can request a review to try to get more hours. And I know we have some people that get quite a few hours. In some cases, they use a combination of consumer directed help, somebody that personal assistants that they hired themselves. And then they sometimes use supplement with an agency that comes in, on the weekends or at nights or something. And they have been able to get quite a few hours, but the person does have to formally ask for it and go through whatever the process is that the CCC plus waiver would use. Everyone has, in Medicaid Works and any other type of covered group, if the person has any kind of a disability or a major health concern, condition, they're probably going to be enrolled in managed care. I hate that they name this the same thing, but we have the CCC plus managed care program, which is not the same thing as the waiver. I don't know why they did that, but there's a lot of confusion about it. But the person's who is in managed care is going to have a care coordinator, and that's who they go through. So the care coordinator that works with their managed care plan, which would be like Virginia Premier or Anthem, that's the person that will help facilitate getting more hours approved. So it does need to go through, that mechanism. It's not something that the local eligibility worker can do. It's not something that I can do.
Thanks. And somebody says that they have a client who tried to enroll in Medicaid Works. The worker would not take the agreement because they said because of the public health emergency, their Medicaid is going to continue. That might be one of those situations where you might want to get with Susan separately. And her contact information is on the very last slide of the PowerPoint. And, Susan, can try to figure out what's going on there.
Yeah, if they literally would not take it, then I definitely would like to know about that. And I will work with there's a regional Medicaid consultant that works for the Department of Social Services, and I will coordinate with that person to make sure that they do get the agreement and they put it in the record and that they honor the month that it was submitted or that you tried to submit it, that it was signed. Because I think that's more of a misunderstanding. They're correct in not changing it, but they should have accepted it and put it in with all of the other documentation in the case so that they could go back and see it.
Somebody else says, would you recommend that someone who is a high wage earner apply prior to the start of a new job? I'd say if they're not already on SSI or 1619B and deemed financially eligible at the start, and there's going to be an income determination, yes, you are going to want to have that client apply as soon as they have that letter that documents what they're going to be earning and what their start date is. I would recommend that they enroll as soon as they have documentation of that job offer, just to make sure that they would meet the income criteria for initial eligibility. The sooner they apply, the better. And they can do it as soon as they have that offer letter in hand. And there are still people coming into the waiting room, even this late. There's still people that are coming into the waiting room. I don't know if people are getting booted out or what, but just as a reminder, This is being recorded, and I will send the link out to everybody. So if you have missed anything, any part of the presentation, don't worry. You will be able to go back and listen. Okay. Somebody asked, for a married beneficiary with a spouse that is not disabled but has earned income, is the spousal income counted toward initial eligibility?
Are you going to answer that or?
Oh, no, go ahead, Susan. I'm just,
So can you repeat the question? I just want to make sure I understood it correctly.
yeah, so they're asking if you have a client who's married and the spouse does not have a disability, are they going to look at spousal income when they look at the client's eligibility for Medicaid Works?
No, they don't. And I think for years, I was not explaining that correctly. I would go and do trainings, and we would say that the Medicaid Works members' spouses' income and resources were never counted. And then I don't know, one day I just kind of hit me in the head, when I was looking at the policy, that what it actually said is that we follow the same assistance unit rules as other ABD groups. So if the person doesn't, we call it a deemable income. So if the person has a disabled spouse or a spouse who's over 65, in other words, this person's ABD, and they either already have Medicaid or they're applying at the same time, then we would actually look at their income as a couple. If they if they have a spouse, but that spouse is not applying for Medicaid and they're not disabled, then the Medicaid Works rule is that we don't deem the spouse's income. So it's kind of a nuanced thing. We would normally deem the spouse's income if they weren't applying for Medicaid Works, if they were just applying for Medicaid coverage in one of our other ABD covered groups. So that's what the Medicaid Works policy is that we don't deem income, but we do follow the assistance unit policy for an ABD couple. Resources are always going to be counted as a couple for initial eligibility, but then after the person's eligible or not, we would just look at the Medicaid Works members.
And there's another one. Do you recommend that SSI recipients coordinate their 1619B enrollment and Medicaid Works at the same time? Yes, you can actually submit a request for 1619B and Medicaid Works at the same time. And that's advisable because if you have a client who's 1619B eligible and maybe they go past their $2,000 resource limit for the 1619B covered group, if you have a Medicaid Works enrollment request that also has been submitted, it should just be a matter of the eligibility worker changing the coding from 1619B to Medicaid Works in the system to prevent any lapses of coverage. So I would recommend that both get submitted at the same time.
And I would just like to add that I just want to make it really clear that everyone understands that those are two different processes. So the 1619B determination comes from the Social Security Administration, and the Medicaid Works determination comes from the local Department of Social Services. And even if a person has 1619B, they have to still have an eligibility worker determine either that they're eligible in the 1619B Medicaid covered group that we have for people who have 1619B status, or in Medicaid Works. We are not one of those states where people are automatically enrolled in Medicaid, or the changes in their SSI status have any bearing on their Medicaid status, not at this time. Again, things might change, we never know. So I've actually run into clients and family members who did not understand that difference. And they had a child, a family member who had 1619B, and they just assumed they had Medicaid Works. And they had never applied for it. They had never asked for it. And I just want to make sure that while I'm talking to a group of people that are assisting with this process, so that you can help the families understand and the clients understand, or both in a lot of cases, that this is a separate process. One thing does not automatically get the other thing.
Yeah, normally what we do is there are two form letters that we developed. One goes to the Social Security Administration, and Social Security is actually responsible for, like Susan said, making the determination as to whether or not the client meets all the criteria for the 1619B Medicaid. And then the other letter goes to the eligibility worker at DSS. And actually what will happen, and correct me if I'm wrong, Susan, is that Social Security will actually share that determination with the Department of Social Services through the state data exchange system. So the social services workers should have that determination from Social Security at the time that the client applies for 1619B.
That's right. And so the worker will look at the data exchange to see that the person now has the 1619B status. And then the person also, to be eligible for 1619B, the group that we have for people with 1619B, they have to have been eligible or had been enrolled in Medicaid the month before they lost their SSI payments, before they became 1619B. So it's not something that a person who hasn't had Medicaid can, just now come in. They can, but they're not going to be looked at in that cover group. They'd have to, meet the same eligibility criteria as any other new application. We don't run into that very often because most people, who with SSI have Medicaid. Definitely most younger people do. I think there's still probably a few people over 65 that don't, because they may have Medicare instead, or they just never wanted to apply for Medicaid.
Okay. And we have roughly 15 minutes left. I don't know. There's a lot of questions in the chat. We'll get to as many as we can, but if we don't get to your question, maybe you can email it to me, maybe CC Susan on it, and we can get to any questions that you have if we don't address them here. Next question is, can someone who is pursuing self-employment apply for Medicaid Works before they have actual income coming in? Well, I would assume that if the answer to that would be yes. Probably what they would submit as proof of employment would be a copy of maybe their business plan or something of that nature. So yes, they would be able to apply if they were self-employed, even if they weren't earning income yet. But the expectation would have to be that they expect to.
Yeah, I would agree with that. I don't know that we've had that situation, really. We have had people that are self-employed already. They might have a small business. I know of one, I think the person was doing, had a lawn care business, yard care business. And so the worker will look at their tax records or the books or whatever you want to call it for their self-employment business. But I think if a person, they would have to be able to verify it with the eligibility worker that they've got a business they're going to pursue. So, a business plan would do that. And a loan from a lender, would do that with a business plan. I'm not sure, it might be harder for them to just say, hey, I want to start doing something next week or next month, and verbally tell the eligibility worker. So if that ever happens, I guess just contact us. Haven't seen that happen, but we can get further guidance on it.
Okay, so somebody else says they have a client who tried to apply for Medicaid Works, and the Medicaid worker was not aware of the Medicaid Works program. Again, that would be another one that I would suggest that you maybe follow up with Susan on, and she can kind of maybe communicate with the worker. Susan, if you wouldn't mind.
No, I would be my pleasure to do that. That's probably one of those cases of it's an agency that doesn't get very many requests, and just some agencies just don't. Smaller agencies some of them may never get one, or it could be a worker, an eligibility worker who's fairly new. If there are areas, and I'm just going to name Virginia Beach just because I'm off the top of my head, I know they have a lot of people enrolled in Medicaid Works, that a newer worker, I would hope, would go seek out their supervisor, or another worker, if somebody said to them, I want to apply for this Medicaid Works program, and you had no idea what that was. It's also in the policy. You can always direct the person to look at the policy is in chapter 3 of the Medicaid eligibility manual. It's in subchapter M0320, which are the ABD covered groups. And sometimes as an ally, you can be very helpful in just, steering them to the policy if they truly really don't seem to know what it is. Sometimes we have a language difference, and I'll give you a couple of examples of that. 1619B, the covered group for Medicaid, is actually called the QSII, Qualified Severely Impaired Individual covered group. And we added 1619B to the name because we were having a lot of problems with people with that, where the workers didn't know what that was. And then what what everybody else in the world refers to as disabled adult child Social Security benefits, our policy calls it the adult disabled child cover group. It's a protected cover group. So just sometimes even things like that. So if you used any other term, if you called something the Medicaid buy-in, you might have a worker that doesn't know what that is, who, just somehow missed that. If you said Medicaid Works, they should know because that is the formal name for it. And we also have people coming from other states. And from what I can see, it looks like perhaps some of you all might be working in another state. I see somebody that has Nebraska by their name. But if we have a person from another state who wants to move to Virginia and they've been in a Medicaid buy-in program, they wouldn't have any idea what we call it in Virginia. So we actually had a situation where I had to get the web development staff to fix that because they didn't call it Medicaid Works. I said, no one's gonna, or they didn't call it the Medicaid buy-in. I said, no one's gonna know what they're looking for. So sometimes it is just a language thing, between different agencies and everything. But yes, bottom lines, I would like to know about that case for sure.
Yeah. Somebody says that they have, and Heather, I assume this goes back to your client who was on 1619B Medicaid, and you said he's about to terminate due to resources. If that's the case, he's a Virginia resident, he's on 1619B, my recommendation would be to have him submit the Medicaid Works agreement and the supporting documentation to his Medicaid eligibility worker right away. As long as he's on 1619B, when the Medicaid Works enrollment is requested, he should automatically meet the resource criteria.
As long as he doesn't have countable real property.
Right. Yeah. So if he has a property that he's not living on or using for a business, that could count against him. But he probably, if he's on 1619B, he probably wouldn't.
Most of our people who are Medicaid Works, I don't believe most of them even own real property. But the other major difference, the real property difference that I don't think you've mentioned, is the contiguous property. That's what usually makes people ineligible. They may live, especially in a rural area, and they have a whole lot of contiguous property to their homestead. And SSI disregards all of that. Well, Medicaid doesn't in Virginia. We count we disregard the first $5,000 in contiguous property, but we count the rest of it. So that's actually the most common situation we have. But it also could be people that have other property that's not their home that we would count if it can't be disregarded for any other reason.
Which is why, you know, by the way, for those of you who might not know, that's why Medicaid is not automatic for SSI recipients in Virginia, because there are a little bit stricter requirements in terms of property. So yeah, hopefully that'll be addressed someday, but
I think it will be changed someday. Don't know whether it'll be before, I retire, but I do know that there are people actively looking at it. So.
mhm. Okay, we have, let's see, roughly 10 more minutes. We'll try to get through maybe just a few more questions. So if somebody gets a job offer and they apply for Medicaid Works, if they then have to start work before the process has been approved, will this income count against them? Or, yeah, I gotta scroll down. Okay, I think basically what she's asking is that somebody applies for Medicaid Works while they have a job offer, but before they start earning income, is the income that they start earning going to count against the initial eligibility criteria? So I think it goes back to my answer about, whether or not they're on SSI at the time that they apply for Medicaid Works, they're going to be deemed eligible just on the basis of that. And also they're going to look at income that the client has when they apply for Medicaid Works. So,
And so with Medicaid, this is why it is important to have the person apply really soon after they get a job offer or they start working, because outside of the pandemic or the public health emergency, where we know that they aren't making changes, normally we would, the worker would look at their, if they made the request, let's say they made the request in December, we would be looking at their Medicaid Works starting in January, but they wouldn't have income yet. So the worker is going to evaluate the last month's equivalent income. So depending on where you are when they submit the request, they could be looking at the month before the request and the month that the request was submitted. If the person gets paid twice a month, they could be looking at the last two paychecks. And so that's what they're going to use to determine that threshold of 138% of the federal poverty level. And that's why I keep saying that when the public health emergency is over, that's going to be we go back to that month when the agreement was submitted. That's the month of income that the worker's going to need to be looking at. And the client or the member may have to, provide pay stubs for that. They probably will, actually. So hopefully they're keeping, records, or they can get them from their employer if they need to. But so it is really important for them person not to start working, in a high paying job until they get the Medicaid works going.
and somebody asks, and we covered this already, but somebody asks if there's specific Medicaid Works contact that they can contact per region when they have an enrollment request, or if not, Susan, can we reach out to you when we have a client with issues or questions about Medicaid Works? And yeah, Susan's wonderful and she's always available. I don't think that there's a specific contact for Medicaid Works.
It's me. It's me. And then I work with the regional consultants. There's one in every, there's like one in every region of the state. They are Department of Social Services employees. I used to be, on the other end, the other side. And so they were my coworkers. So I've known them all for years. But they're my liaison to the local departments of social services. So I generally don't pick up the phone and talk to the eligibility worker. I have them do it for a whole lot of reasons. But but we always, get the issues taken care of. But I'm a person that you can contact if you've got questions, and definitely if you've got issues. And honestly, Michael knows as much about Medicaid Works as I do. So just for questions, you can contact him. If it's not an issue that you would need somebody from my end to intervene in.
I see a couple people are asking for the form letter I developed for the folks to take to the bank regarding the work incentives account. I can send that to you. Just shoot me an email reminder that you need that, and I'll make sure I get that out to you. I have found that that eliminates a lot of the confusion when folks go into the bank or credit union to get that set up. Let me just double check the time. We got about 5 more minutes. Somebody asks, when designating accounts as a WIN account, does the bank have to do something to designate this? Or, hold on. There's so many questions. Yeah, folks, we're not probably going to get to all of them. But again, email us your questions after this, and we will do our best to get back to you and answer any questions you have. But I'm thrilled. I'm thrilled that people are asking so many questions and that we got such a great turnout. This is fantastic. Okay. Is there a limit to the number of personal care attendant services or hours that an individual can request if they move to Medicaid Works? This would be in regard to an individual who receives and needs PCA through the DD waiver. Well, I'm not an expert on personal care, but I think that the determination as to how many hours a person gets would be the same, whether they were on waiver or receiving personal assistance services through Medicaid Works. In terms of that component, I wouldn't imagine that the determination would be any different.
Well, actually, Michael, I think I know what they're asking, and it could be. This gets back to what I was saying about the DD waiver and the CCC plus waiver are different, and how they determine eligibility for personal assistance hours is different. They use different criteria, where for the CCC plus waiver, they're mostly looking at a person's physical medical needs, and then perhaps if a person has a cognitive impairment or something like that, versus the DD waiver, where they're going to be looking at a broader scope of the person's needs. I have yet to see a case where it couldn't be worked out, but I call it growing pains. And I will tell the members I talk to that they can expect that there might be some bumps, on the road, because the CCC plus criteria are a little different. They do have a cap. Technically they have a cap because the CCC plus waiver is supposed to be the alternative to nursing facility care. So if the person needs 24-hour personal assistance, they're not going to be approved for that because they would need to be in a nursing facility. So there is some kind of a limit. I'm not sure exactly what it is. And it may change, but that's where the person has to say, I need this amount of hours because I'm in Medicaid Works and I need personal assistance to go to work, at work, to come home. And then nights and weekends. And then they work with their care coordinator and their managed care plan to make sure that they're getting enough approved hours. And we have people also at DMAS that can help intervene in that process. And they've had to do it, because it was sort of a new thing, where because people weren't leaving the waiver the DD waiver to go into Medicaid Works for, a lot of reasons. They were afraid to do it. So we've had to do a lot of education and coordination to, get through that process. So the bottom line is the person has to have this documented need, that they need more hours, and they should be able to be approved for them. But there is going to be a limit. No one's ever going to get 24-hour personal assistance.
And we have time for just one more question. And again, if we didn't get to yours, you can email us later. But the last one is, where is the policy regarding the pandemic emergency period in writing? Is that written down anywhere? Like, is it in the manual or?
We have given written instructions we call Medicaid broadcasts to the eligibility staff. But we haven't changed the policy manual because it's temporary policy. So we don't make those kinds of changes in our eligibility manual. But this goes back to, the policy would say that the person has to be eligible. I mean, and the policy does say this part, the person has to be eligible the month that they request Medicaid Works. And they will be looking at the income in the month that they request it and possibly the month before they submit the agreement, and that their Medicaid Works is going to begin the month following the agreement. So because we have been, just frozen everything, we will have to pick up where we left off when the public health emergency is gone. And then we have the policy to support that. And that's why I just need to know if you have any problems, because that's where I have to, be involved with the eligibility staff. What we might do if we find that we have a lot of people this is going to impact is I can do a formal broadcast then. Which people still miss the broadcast. So honestly, it's just the personal touch is probably better anyway. And if I were to do a broadcast, let's say right now, people are definitely going to miss that if we come out of the public health emergency, next summer sometime. So I don't know if that makes you feel better, but as long as the person has submitted their Medicaid Works agreement, or in the case of the client that wasn't allowed to, I definitely want to know about that one. We'll get it submitted. But as long as a person has submitted it and they've done everything that they should have done, there should not be a problem. The person can't have started working 6 months ago and now submit the agreement. That it won't work that way. Except for that case where they tried. If they tried, that's different. But they can't just decide now, I want to get into Medicaid Works. They could be working, but they'd have to still be income eligible to get into Medicaid Works. I hope that helps clear it up. And again, just, we will address these cases as they come up.
Okay, thank you. And with that, we are right at 3:30. I want to thank you all for your time, attendance, and participation today, and for asking some great questions. I want to thank Susan for joining us today, and the captioner and the interpreters for being here. And I hope you all have a great rest of your day, and happy holidays to everyone. And I will send this link out to the recording as soon as I have it available. Thanks again, everybody. Bye-bye.
Okay, bye-bye.